All right. Dr. Jepson.
Hospitalizations to date through the entire pandemic occur in the last couple of weeks. And we've signaled for the last several weeks that healthcare systems are close to the crisis standards of care. Yesterday, Monday, Labor Day, kootenai-Health brought forward a request due to the increase in COVID-19 positive patients that they've seen as recent as over the weekend. Like all hospitals across the state, they've faced staffing shortages. And as we announced last week, we have deployed additional resources, both from the federal and state level, to help out that have arrived over the weekend and will arrive this week. But even with those additional resources, it was still not enough to cover the current surge in patients. In addition, bed space is becoming very tight in North-Idaho. Yesterday, Kootenai had their record high for COVID cases for inpatients, critical care ICU, and number of patients on ventilators. And we expect those numbers to increase over the next few weeks. Because of their situation, they've had to turn away transfers from other local hospitals in the region. As you may know, Kootenai serves as a hub for high-risk cases and highly complicated cases to go to them for services, and they've just not had the capacity to do so. And as of yesterday, patients are now being boarded in a converted conference room due to the space limitations at the facility. Normally, regional hospitals across the border in Spokane would also be able to help out, but they are also full and unable to provide the assistance that they normally would. I'd like to thank kootenai-Health for everything that they've done to alleviate the resource constraints, and they've really pulled out all the stops to find every way possible to alleviate the resource constraints. However, given their situation, they did make their request, which means we convened the Crisis Standards of Care Activation Advisory Committee yesterday afternoon late. And that committee, after a lengthy conversation with the requesting hospital, had a long conversation looking at all the data in the situation and did recommend that we activate crisis standards of care. Subsequently, I declared crisis standards of care for North-Idaho and the Panhandle and the northern-central health districts be activated. This means that hospitals there may implement crisis standards of care protocols. We will continue to work statewide to alleviate the situation, and we'll continue to monitor daily the situation and review options that we have. Some of you may be wondering, what does this mean for you, particularly if you live in North-Idaho? What it means is, if you go to the hospital, you should expect a longer wait time. You may not be seen in a traditional space. In fact, you may be seen in a classroom or a hallway, or you may be sent to a different hospital that has more capacity. The situation across the state is not much better. And we're going to share a chart here for a minute of our hospitalization numbers across the state. And I'll let Nikki get a chance to bring that up. And what you can see here is the top line is number of hospitalizations across the state. You can see that we hit a new high last week with a daily average census of 496 across the state for COVID patients in the ICU. We hit another record this last week with a daily average census of 154. And the bottom line there is ventilator use, which is at its highest level with a daily average census of 89. Thank you, Nikki. We expect, as I mentioned earlier, these numbers to get worse in the coming days and weeks. And the real answer for all of us is to choose to get vaccinated. And we're going to show another chart on that here, and I'll give Nikki a chance to bring that up. And here you can see our vaccinated versus unvaccinated in the numbers This is data from May 15th, when everyone in Idaho 16 and older was eligible for a vaccine, to last Saturday, September 4th. And here in these numbers, you can see the number of cases and how many of them were vaccinated versus unvaccinated. 90%, or 32,600 out of 36,200 cases, were from unvaccinated individuals. And I want to pause here and just mention that across the state of Idaho, we only have about 0.53%, that's less than 1%, of vaccinated people in Idaho who have had a breakthrough case of COVID-19. The vaccines are highly effective at preventing cases. You can also see that 92% of our hospitalizations, or 1,400 out of about 1,500, were from unvaccinated individuals, and 89% of our deaths, or 243 out of 274, were from unvaccinated individuals. I hope that your takeaway from this is that the vaccines work. They are safe and effective. They are the best tool by far that we have to prevent people from getting sick, and certainly to prevent people going into the hospital. For those of you that have chosen to be vaccinated, thank you. Your choice makes a difference for you and the rest of Idaho. For those of you that have not chosen to be vaccinated yet, please consider choosing to get vaccinated. And please consider choosing to get vaccinated. For all of us, please wear a mask indoors and in outdoor crowded spaces. It's also a secondary tool in addition to vaccination that will help slow the spread, particularly as we feel this pressure on our hospitals. And then more generally, I would encourage all of us to just be a little more careful. Wear your seatbelt, take medications as prescribed, reconsider high-risk activities that could land you in the hospital, as that's where we are in terms of hospital capacity at this point. And with that, I'm going to hand it over to Dr. Scoggins from Kootenai-Health.
Okay, thank you. I was going to talk about what's going on in our hospital here at Kootenai, how things have changed over the last month. At the beginning of August, I think we had around 25 COVID patients in our hospital. We've had a COVID unit since last year, over a year. We've never shut it down. We've never gotten to 0 patients. We've always had COVID patients here. In the last month, we've seen a rapid increase, as those graphs showed, of hospitalizations of COVID patients. They're mostly the Delta variant. I think now it's 99.9% Delta variant that from the data we get from the state. Yesterday, we hit our peak of 113 COVID patients in the hospital. That is a significant percentage of our hospital beds. We have 39 in critical care. 19 of those are vented on mechanical ventilation. The remainder in critical care on high flow oxygen. They're patients that we are concerned may need to go on a ventilator. We are taking care of patients and converting many wards now into COVID wards for both acute care, lower level, step down, which are a little bit higher needed patients, and then also critical care. Normally we have 26 ICU beds in this hospital, and you may ask how we can handle 39 COVID patients, and actually our total ICU census is right around 50, and that's because we converted about 32 extra beds, usually med-surgical beds, into ICU beds last year in preparation for something like this. And so it's put an extreme strain on our resources, our nursing. They're doing team nursing throughout the hospital to where, such as in the ICU, in certain cases, we have one ICU nurse for 6 patients, and she's working, or he or she is working with 2 other nurses to care for those patients to keep the ratios 1 to 2. And the ICU nurse supervises the other 2 nurses. Not ideal care. We've been doing that for the last couple weeks, and now that's expanded into other parts of the hospital. We've had significantly more younger patients with this Delta variant than we had before. Our age range in the hospital goes from 18 to about 80, 81, I think, today, which is a significant difference in what we had last winter. when the majority of our patients were over 65. Now we have many patients that are under the age of 65. And along with the data that was shown, most of our patients are unvaccinated. We average about 10% the patients are vaccinated. Many of those are immunosuppressed in some reason, for some reason. Cancer patients, transplant patients, people who are on other immunosuppressants for autoimmune diseases. And so, it's those patients normally may have difficulty responding to the vaccine. I think that the thing that's really changed for us has been seeing that younger patients are dying from this. And it's quite disturbing to see these patients declining, and they're what I would consider healthy. They're normal, everyday North-Idaho people. They may have some comorbidity such as hypertension, but honestly, we've had patients with really no significant past medical history who have died from this Delta variant. We also have many in the hospital now requiring high amounts of oxygen and or ventilation that didn't have any prior conditions. We've moved into our conference center for patients. We converted that a week or two ago to house 22 patients, and these are usually our lower level patients. We've added oxygen in there. It's not obviously an ideal setup. It's a conference room that we put beds into. It's an open setting, and with dividers. The staff wears PPE all the time in that facility. And in fact, our third floor of the hospital is now completely COVID patients. And in every ward, we do continuous PPE. So the nurses are wearing masks and gowns and gloves, taking care of these patients. And unfortunately, our percent positivity rate up here in North-Idaho continues to be high, and that's a predictor of hospitalizations. We saw that with the first two waves. As our percent positivity went up, we continued to see admissions, and we didn't see a decrease in admissions until that percent positivity went down. And by our testing, it's anywhere between 25 and 30% over the last 4 weeks or so. So we expect to get more patients. I think I'll end there and we can move on.
Thanks, Dr. Scoggins. We'll also hear some comments from Elke Shatelik.
Great. Thank you both, Director and Dr. Scoggins. Really appreciate your remarks. So you have heard a lot about the stresses and strains that the hospitals are under right now and the extreme measures that the hospitals are having to take to continue to provide care for patients. At the federal, state, and local level, we and our partners are doing what we can to support hospitals. And I just want to run through a few things that we have been doing. We've been supporting hospital requests for both their clinical and non-clinical staffing through the Department of Defense staffing support. We've secured a staffing contractor assisted by the General Services Administration, or GSA, to bring in hundreds of people into the state to be placed in hospital settings across the state. You heard us talk last week about the Idaho National Guard staffing support and the release of approximately 150 guardsmen, mostly the non-clinical staff that can be supporting the hospitals across the state and other partners. We have AmeriCorps volunteers that will be available in November. We've provided hospital grant funds to support the hiring and retention of staff locally in hospital settings, as well as any space and treatment issues that they can bring to light. We've offered $4 million and have already made over 27 awards across the state. As you heard the governor say last week, we've waived licensing fees for retired or inactive nurses. So they can activate their licenses and re-enter the workforce more easily. We've continued call-outs for volunteers through the Medical Reserve Corps at volunteeridaho.org. We're also supporting hospital coordination activities for patient transfers and requests across the state for support. We are convening the hospitals twice a week for hospital capacity calls where we can share information. There are daily calls with hospitals that discuss medical operations and coordination across the state. We're working on an app that can help connect hospital transfer centers quickly to one another to help quickly move patients from one location to another to assist in those coordination efforts. We've been supporting physical patient transfers through our coordination efforts and working with our EMS providers and others. And we're also making requests for civilians to be cared for in VA facilities at the Boise and Spokane VA hospitals, of course, based upon availability. However, given all that, we need all of you as Idahoans and those of you who visit Idaho to do your part to help ensure that the hospitals can provide the care that we all expect when we walk in the door. I have 4 very concrete things that you can do, and they reiterate exactly what the director had said. We need people to be careful and avoid all those activities that would create the situation for them to need to go into an emergency department. So be cautious about driving and bike riding and all those things that might cause a significant event where you need to go in for care. Of course, all this comes with the caveat, if you need care, please seek it, but do your best to avoid going into the emergency room. Also, avoid using the emergency departments for your place to get asymptomatic COVID-19 testing for work, concerts, travel, etc. If you're looking for places to get tested, you can visit, of course, the gettestedcovid19.org site. You can find a variety of locations near you, such as a pharmacy or a primary care office where you can get a COVID test if you're asymptomatic. You can also call the Idaho Care Line at 211 to order a free at-home saliva-based PCR test. Of course, again, we want to emphasize that if you are symptomatic, if you need health care, please seek it. We're not asking for you to not go in if you need care, but if you're going into an emergency department simply to seek an asymptomatic testing for something, there are other ways to find that. Of course, as the director said, get vaccinated. It's the safe, effective thing to do. As he said, there are almost 92% of people in the hospital right now with COVID-19 are unvaccinated. And of course, wear your mask indoors and crowded outdoor locations. We know these things work, and we know that if we do these, we can help provide support to our hospitals. It's really important that we do that. And these are easy things for us to do and do our part. And Nikki, I'll turn it back to you.
All right, thanks, Elke. Before we open it up for questions, I do want to point out that we did post the links to both of the graphics shared during Director Jepson's opening comments. If anybody would like to see those, you can access those there. Okay, so we will now take questions from our media participants. Please raise your hand in WebEx or type your question into the chat area. When I say your name, unmute yourself and announce your name and media outlet before asking your question, and try to remember to clear your hand when you're done. Because of the number of media on this call, we are asking you to keep it to 1 question each time you're called on. We'll do our best to get to everyone in the time that we have today. So I see, let's see, I'm not sure who is first. We'll start with Audrey Dutton.
Hi, Audrey Dutton from the Idaho Capital Sun. What is the outlook for the rest of the state? How will crisis standards in North-Idaho affect the rest of the state? And how close are we to needing a statewide crisis standards?
Thanks, Audrey. I'm going to be having the director field most of those questions around crisis standards of care in this briefing. So, Director, I'll turn it over to you.
Thanks, Audrey. Great question. The process we would follow is the same process we followed here. Is we would look for those that are closest to the situation and have the ability to allocate and acquire resources, or think of that as hospitals or healthcare entities. We would expect them to make a request to activate crisis standards of care in another region of the state, should we get to that point. Just like we saw here, when that request is made, we'll have a quick conversation with the hospital or hospitals that are requesting, and then convene the Crisis Standards of Care Activation Advisory Committee, and then they'll make a recommendation to me, and then I'll make a decision. So that process would be the same. As noted earlier, we have had that request from up north. We have not had that request for the rest of the other parts of the state. And then the second part of your question is how close are we? And I don't actually want to speak too precisely to the hospitals. They are much closer to this than I am. But I will say what I have said for the last couple of weeks, which is for the rest of the state, we remain dangerously close to crisis standards of care. If we will look to see if there's any additional assistance that we can provide to Kootenai-Health and other hospitals in the north by way of transferring patients. And while I greatly appreciate the hospitals in the southern part of the state stepping up to that challenge, that could further exacerbate the condition in this other part of the state, and we'll deal with that as that situation materializes.
Okay, we're going to move on to our next question, and that's going to come from Hyatt.
Hi, Norimine from the Statesman. How many hospitals have requested additional staff through the Office of Emergency Management, and will the additional staffing be enough? Are there other resources that Idaho's going to be in need of pretty soon?
Thanks, Hyatt. I'm not sure I could really hear the second part of your question. I think it was the total number of requests. Could you repeat the second half?
Sorry, yeah. Will the additional staffing be enough, or will Idaho need additional resources on top of just staff?
Oh, great, thank you. We have had multiple hospitals seek assistance for staffing and space and other positions, and not all of the requests coming in are clinical in nature. We have some, of course, that are for environmental services, for example. I think I've talked about that on past media briefings. I don't have the exact total right now. I think we have, because some of the requests coming in are getting some modifications, and we need some very specific information from hospitals. So I don't want to be too specific about it. But right now, we do have access to some of our new vendors that can bring in, at this particular point in time, upwards of close to 350 staff. As we know from Kootenai's experience with huge numbers of staff that are vacant right now, it's going to be tricky. We likely will not be able to have sufficient numbers of vendors coming in or staffing support coming in, but we also know that it's a very fluid situation. So as we hope, we have not just the staffing contractors coming in, but as I mentioned, we have funding supports to hospitals to also hire locally. So we're hoping between the combo of hospitals
Okay, Joe Paris will have our next question.
Joe Paris, the KTVB in Boise. I had a question about how the crisis of standards kind of work going forward. I guess the specific question would be for North-Idaho, is this something that the crisis standards of care could be not needed anymore on Friday, and there's a petition given to the state saying we don't need this anymore, and then the following Monday it's okay, we're back in that same situation? I guess the question is this something that you would go in and out of quickly, or are we expecting to have crisis standards of care kind of be the norm in North-Idaho for now for the coming days or weeks?
Director and Dr. Scoggins, do you want to both field parts of that?
Sure, I can kind of give the high level, and I'll hand it off to Dr. Scoggins here. So, Joe, great question. I think I know for a fact that all of the hospitals, including Kootenai, as well as the agencies that are supporting the response, want to see crisis standards of care be in place for as short a period as possible. And that'll depend on caseloads and staffing and other resource constraints. And it would be great if by Friday we could be out of crisis standards of care. I'm not sure that's going to happen per se, just given the current situation, but we will work as quickly as we can to support the Kootenai in particular and the rest of the hospitals to see how quickly we can get out of crisis standards of care. And we will make that decision as it's warranted. And so if we get into a situation where it's clear we can go back to the usual standard of care, even if it's stressed, but we can go back to the usual standard of care, we'll do that. And then if the situation changes again, we would then relook at crisis standards of care. So we are going to watch the situation daily, monitor daily, and then make decisions as they're appropriate for the situation on the ground. And then Dr. Scoggins, I'd hand it over to you.
Yeah, I think that it's a great question. We've constantly been reevaluating almost hourly on utilization of our resources. And as we, hopefully numbers go down, we would quickly get back to our normal standards. unfortunately, we haven't been really at our normal standards for some time. We just got to an extreme condition where we had to move into our conference center, and we were doing things that were not our normal and way outside of normal at times. So, it depends on how many patients we have here in North-Idaho. The quicker that number goes down, the better off we are. But with our positivity rate, we expect to continue to get patients. And I suspect that we'll continue to have our numbers grow over the next at least week or so, as there's not a lot of mitigation strategies in North-Idaho right now. So, but we'll continue. If it were to go away tomorrow, we would be out of crisis standards pretty quick. But I don't see that happening either.
Okay, thank you. Our next question is going to come from Nicole Camarda.
Hi, this is Nicole Camarda with Idaho News 6. I had the same question as Audrey, but a little bit going back to that. Do you guys predict that we will, in the Treasure Valley, move into crisis standards of care at some point? Or are you obviously hoping that we can kind of escape that situation? At what point would you expect we move into it, if so? And what should the people of the Treasure Valley expect if this unfortunately does happen in this area?
Well, Nicole, I'll start the first part in that we do have tools at our disposal to prevent us from getting there. And we keep talking about that over and over again as public health professionals, that, if more people get vaccinated, more people do all those mitigation measures, we can stem the flow of people going into hospitals, and we can avoid that in the first place. And we can quickly get our hospital that is in crisis standards of care out. That said, the director did signal that, hospitals have said they are dangerously close. But I'm going to turn that back over to the director and let him finish up the comments. But I just want to really emphasize that we do have ways to get ourselves out of this.
Thank you, Elke, and I will reiterate that the best method we have to prevent crisis standards of care in the rest of the state and get out of crisis standards of care in North-Idaho is the individual actions of the people of Idaho, and so that is our best method we have. To your question that you've asked, to the second part there, again, we are really close. It's the hospitals. You can see it in the numbers we've shared, and it's true across the Treasure Valley and the state that we every week we set a new record for a number of cases and ICU cases and patients on ventilators across the state. So I think it's hard to say exactly when we would tip over and a hospital would request that we move to crisis standards of care in the Treasure Valley, but that is a distinct possibility, particularly given the current trend of cases that we see. And it's again very close to that. If that were to happen, the same thing would be that I described earlier, and that Dr. Scoggins has described, is that we would expect to see a different level of care, and that would mean longer wait times to get into a hospital, an ER room, potentially being seen in non-traditional places such as hallways or conference rooms or other spaces at the hospital or even outside of the hospital, being diverted to another facility that may be further away but has actually space to be seen. And in the hospital itself, seeing a different level of nursing ratios, et cetera, to patients. And that's what we would expect to see for any institution that's in crisis standards of care. But again, we'll go back to all of you are the best way we can avoid that happening. And I would not only encourage all those safety protocols around COVID itself, but just in general, I would encourage everyone to be very safe in general so we don't increase the load on our hospital system.
Okay, Kyle Fonensteel, you're up next.
Thanks. I think this question is best for Director Jepson, but I'm not sure. I'm wondering, did the activation committee consider any proposals to move the state into crisis standards of care? What were the results of any discussions, and why do you think it's not appropriate at this time for the state to be in the standards?
Director?
Thanks, Kyle. That's a great question. And yes, is the short answer. There was a lengthy debate with the Crisis Standards of Care Activation Advisory Committee about whether the activation request should be for North-Idaho or for the statewide. And that question was interrogated for some length of time in our conversations. Ultimately, the reason that the committee recommended and I agreed and decided for just North-Idaho is in talking to those healthcare entities around the rest of the state. They are not quite there for crisis standards of care. Really, really close, but not quite there. And so we would look for a process for those hospitals that if they do get to that point, they would make a request similar to what we saw yesterday, and we would look at that for either the rest of the state or the region that they operate in. But it was a lengthy debate, and it was clear that it was appropriate for the North-Idaho area. It's a pretty serious thing to declare crisis standards of care. It's something that none of us do lightly and take very seriously. And at the end of the day, we felt like we had just a little bit of wiggle room left in the rest of the state, but I want to emphasize not much.
Okay, thank you. Our next question is going to come from Becky Boone.
Hi, this is Becky Boone with the Associated Press. I'm wondering if you can give us some very specific examples of how the crisis standards of care designation has been carried out in kootenai-health. You mentioned having some patients in the classroom, but you also said that you've taken some very unusual measures, Dr. Scoggins. So could you just give us some specific example of like how that's affecting individual patients? Are there longer waits or people not getting into the ICU, things like that?
Yeah, no, there's definitely been at times we've had longer waits to get into the ICU. We've built out part of a lobby in the ER to see more patients with individual bays so that we can triage patients outside of our traditional emergency room. We've even expanded or in the process of expanding our ER into a different area of the hospital so that we can hold patients there before we can find them a bed. We also have added physicians into roles that they normally don't do. And nursing staff are also, and other staff are doing things that they normally don't do. Of how many beds we usually have, but it's around, I think, 190 medical surgical ICU beds that we normally have, and currently we're well above that with 110 of those at this moment. I just pulled up our tracker that are full with COVID. We normally run well above 80% without COVID in terms of our occupancy, so we were having space issues before we got hit with this surge. And so now we've backed off of surgeries. We're only doing emergent surgeries, and urgent and elective surgeries are on hold at this time. And so things that we would normally take care of very quickly, we may have to hold that off until we get more resources available for those patients. So and that's why we asked for the crisis standards of care.
All right, thank you. Melissa Davlin, you're next.
Thanks, Nikki. Melissa Davlin with Idaho Public Television. I was wondering if the department is tracking or if there are any metrics that show adverse outcomes for non-COVID related emergencies that have been affected by overwhelmed hospitals. So whether you're seeing an uptick in bad outcomes related to cardiac events or anything like that because of a lack of ICU space.
Yeah, thanks, Melissa. We don't have the ability to track a lot of that, but I'm going to turn it over to Dr. Hahn and Dr. Turner to see if they want to add some additional detail.
Yeah, I could start. Thank you, Elke. As you say, Elke, we are one of the few states, actually, we do not have a hospital discharge database in Idaho. So we don't have the ability to track hospital outcomes as well as some other states do. That said, of course, the most severe potential outcome would be an increase in mortality rates due to other causes. And we will be looking at that, of course, and as we have been throughout this pandemic. We know that deaths have risen due to COVID and other respiratory causes. We will be watching this very closely, but we don't have a hospital discharge database. And Kathy, Dr. Turner may have more to add. She might be thinking of some other things.
Hey, thanks, Dr. Hahn. I have nothing to add. That was perfect.
Okay, we'll move on to our next person, and that would be Ruth Brown.
Hi, thanks, Nikki. I really appreciate everyone's time today. I have a question about healthcare workers. Outside of those who perhaps have practiced medicine, maybe in a war zone or some type of natural disaster like a hurricane,
Ruth, that's a great point, and we do hear that a lot about healthcare workers and the toll it's taken on them, and that kind of moral and ethical dilemma that they wind up facing in these situations. I mean, I have Dr. Scoggins talk about information firsthand, and then of course, kind of the back end of that, we are very concerned about that moving forward and helping to support our healthcare workers. So definitely something we want to keep an eye on. But I'm going to turn over to Dr. Scoggins and give us a real life picture of that.
Yeah, it's a tough question, just because it's hard to think about all the things that we've done in the last year and a half with this. It's definitely not something that you train for in medical school and residency, and for me, fellowship. I'm a pulmonary critical care physician, so I'm in the ICU most of the time and have been with taking care of the sickest COVID patients. I think that and I think people need to realize a lot of the nurses that we have are young. They're in their 20s and 30s, and they've never seen anything like this. And so just seeing the illness that goes along with COVID and how sick people get, and then sometimes how quickly they die, and now how young they are, I think it's going to have long-lasting effects on healthcare workers. I think that we are already seeing some people leave the profession in nursing because they get tired. We are seeing physicians leave the profession just because of all of the controversy that goes with it, and they get frustrated with what they see in the hospital, the unnecessary death that's occurring and unnecessary illness, and then also outside of the hospital and what's going on in the communities. There's definitely a sense of lack of support from communities right now for for the healthcare workers, and the nurses have been very resilient. I'm impressed every day that our staff, it's how hard they work and how well they're doing. I mean, it goes all the way from the different staff, the therapists, the respiratory therapists, the housekeepers. It's a team effort to take care of these patients, and it's under extraordinary conditions. And we've been doing it for a while now, and definitely you can see the fatigue in our staff. I wish it would go away quickly, but I know it's not going to.
Okay, oh, I'm sorry.
Oh, can I just add something onto that?
Of course.
So we actually do have a counseling assistance program for frontline workers that would include healthcare workers. And you can find that on the coronavirus.idaho.gov site under behavioral health. And so there are some services available now to help out with what is a very stressful situation.
Okay, our next question is going to come from Shira Matsuzawa.
Thanks, Nikki. Shira with KTVB here. I know hospitals are top of mind, but when it comes to school districts handling COVID cases, we just kind of wanted to get your thoughts on schools and COVID cases, and are you at all concerned? I know different districts are handling things differently, but given that schools have only been in session for a couple of weeks and we've already heard about some closing down or switching to remote learning, we just kind of wanted to touch base.
Yes, absolutely concerned. As you said, we have seen changes in schools and how they're operating, and it is very concerning. As we've talked about the last few press briefings, we are offering financial support to schools to help them with some of their COVID response efforts. And I will turn it over to Dr. Turner, who has some of the data on how many schools have taken us up on that and what we are offering. We're certainly helping to support the schools with any technical assistance as well, and also our back to school task force and our education providers that are part of that back to school task force. But absolutely very concerned about how COVID is impacting schools right now. And Dr. Turner, do you have additional comments on the funding opportunities?
Yeah, thanks, Elke. So I will just note that we've had 17 schools or school districts contact us through the registration site that is on the State Department of Education website to let us know that they're interested in exploring testing modalities and implementing some kind of program. And we are working with them individually one-on-one to ensure that whatever they want to do, we can support them and make it work for that particular school or that particular school district.
Okay, our next question is going to come from Nate Hedgie. I'm not sure if I pronounced your last name correctly.
You did, yeah. Nate Hedgie with Mountain West News Bureau and NPR, kind of bouncing off of that last question. Obviously, there's no statewide mask mandate in Idaho. Most school districts in North-Idaho aren't requiring masks. You know, considering the positivity rates, the hospital situation right now, I mean, is it safe for young and vaccinated kids to be in school right now? I mean, what can worrying parents do if their kids are under 12 years of age and can't get vaccinated? I mean, how can they best protect their kids?
Yeah, thanks, Nate. Of course, it's a great question, and you know, we know that wearing masks work, and an important tool for schools to be using. And I'm going to actually give Dr. Hahn the opportunity to expand upon this a little bit further and what we're recommending for schools, if you want to do so.
Yeah, thank you, Nate. I just heard today that West Ada is now requiring masks for their teachers and staff, which I think is a step in the right direction. And I would just say that I think I've mentioned on this briefing before, my kids go to the Boise school districts, and I'm very glad they have a mask mandate in place. That is, according to my kids, very strictly enforced. And I think we believe that is the best way to keep schools open and to keep kids safe. And we'll just keep iterating that. I think time will show that. I think West Ada is maybe already heading in that direction and realizing that masks are going to protect their teachers and keep outbreaks from happening and keep kids in school. And we hope that other school districts do the same thing.
All right, Rachel Cohen, you're up next.
Hi, this is Rachel from Boise State Public Radio. I was wondering if patients in North-Idaho
We have a network of critical access hospitals that we normally take their critically ill trauma patients. not come just to get like a test for COVID. We really try to do our best to take care of all the patients that come in the front door, and so far we've been able to do that.
Okay, our next question.
The director, if he wants to take that one.
Yeah, thank you, Justin. Excellent question. There was an active conversation yesterday as well. And the reason for that was twofold, at least twofold. The situation at Kootenai, it not only affects those critical access hospitals in Public Health District 1 or Panhandle Public Health, but also in the North-Central Public Health District.
Okay, thank you. Our next question is going to come from Heather Ann Wagner.
Thank you. Heather Ann Wagner, KPVI. Every week we talk about vaccines and masks, and I want to say, not getting through to people that we need to get through to. How are you all feeling now that you're seeing the numbers spike? And is there anything else that we can do to help promote vaccinations and masks and try to help bring this latest spike down? Thank you.
Well, how are we feeling? I think all of us can probably say that we have a pit in our stomach at all times about it, and it's very important that we get those messages across about vaccines and masks. And yes, we keep repeating the point because they're so important. We do seek input through surveys about what might help change people's minds. We're trying to make sure we have educational efforts and push this through our social media, our local partners to help address some of those concerns. But I'm hopeful, we're hopeful that providing this forum and having opportunities for us to get messages out that we can share the repercussions of what happens when we don't get vaccinated and when we don't wear our masks, is that we have hospitals seeking crisis standards of care. But I think we need to be able to appeal to all the reasons why people aren't getting their vaccinations and wearing their masks. And so we're looking to you all too to help us share those messages and put the right words together that appeal to the right people to change their minds and their behaviors. So I would almost feel that we could put that question back to you all. What can you do to help us get those messages out?
All right, thank you, Alki. Our next question is going to come from Kevin Richard.
Yes, hi. I wanted to follow up on this explosion that we're seeing in cases involving school-aged kids. It's sudden, but it's probably not terribly unexpected given how the Delta variant has behaved. Were there steps that the state or the schools could have taken in these past few weeks to head off the situation that we're seeing unfold in the schools now and could see unfold now as the North-Idaho schools reopen?
Sharing the love here and spreading out the responses. So we have opportunities. Dr. Hahn, do you want to field that question?
Kevin, just make sure I understood you. You were asking, are there more steps that could have been taken, or can I just make sure I quite understood your question? Kevin,
Kevin, are you? Oh, okay.
All right, I'll just go ahead and answer what I think I heard, unless somebody can correct me. I think Kevin was asking about, are there steps or more steps that could be taken or could have been taken now as schools open? And I'll just say, yes, I think I already mentioned, I strongly think that mask wearing, whether it's through requirements or whether it's through, you know, the culture and encouragement and voluntary, I feel like kids are safer and teachers are safer, staff are safer if everyone who's vaccinated can be vaccinated, everyone who can is wearing a mask, and of course as much social distancing as possible, which with this weather right now is still possible to a large extent. There can be some outdoor activities, lunch, that type of thing. So yes, and there are other things that we don't talk about as much, but schools can look at their ventilation systems. Of course, there's disinfection, which isn't, I think, as important for this particular virus, but also can be helpful. I think there's a lot that schools can and should be doing. I know many of them are, but I don't think all of them are consistently across the board. And I think if we could increase the use of social distancing, masking, and vaccination among those who are eligible, we would be doing a lot better in keeping our kids in school.
All right, thank you, Dr. Hahn. I'm not sure if we lost Kevin. He's still showing up in our participants list, so I hope he heard that that response. I do have one question in the chat from Karen Bosick, who writes for Eye on Sun Valley, and she wonders, are any rural hospitals in Idaho in danger of closing even temporarily due to staff and other shortages?
That's a good question, and I don't know of any rural hospitals in danger of closing due to staff, but we do know that rural hospitals are equally as strapped for staffing as the larger hospitals. But I haven't heard of any on the brink of a closure.
Great, thanks, Elke. I'm going to start with the second round of questions. It looks like Hyatt Noramina has her hand up.
Hi, yeah, I had a question about EMS responses. How are EMS responses impacted by this? Are 911 dispatchers or EMTs ordered to change the way they operate or reduce responses to certain types of calls?
The short answer to that is no. I mean, I think they're still responding to every EMS call as they normally would. I will turn to Dr. Scoggins to give some examples in North-Idaho, but there are definitely concerns when it comes to having EMS help support some of the transfer of patients from one area to another, because they are kind of so in demand in supporting COVID response. But to date, all EMS agencies across the state are very much actively engaged and supporting patients being transported to hospitals. But Dr. Scoggins, do you want to highlight any issues with your EMS personnel up there?
Yeah, I don't think that I'd say EMS is, I think, operating fairly normally. I think they're busy with just the number of patients that they're getting called to see. It seems like there's a lot of ambulances in our bay. And it is a problem if we are transferring patients to other facilities, because it does take, there's only so many ambulances in an area. And it does, especially if you have to have critical care transport, there may only be one critical care transport for an area. And so those resources are limited. And so, I could foresee problems if we continue to see a rise in patients and possibly having to transfer patients. But, as of now, it's almost impossible to transfer patients anywhere. So that hasn't been an issue.
All right, thank you, Dr. Scoggins. Our next question is going to come from Joe Paris.
For Dr. Scoggins, I was wondering if you'd be able to provide some more, firsthand, view of what you're seeing up there. I think a message from the community that we've had down in the Treasure Valley is we wish we could see or hear about what's really going on inside the hospitals. So I was curious, just for the North-Idaho perspective, you could give kind of a firsthand perspective on what you're seeing and hearing over the last few days.
Yeah, I just got off of a week in the ICU taking care of COVID patients. I think it's, if you don't work in a hospital and you don't do what I do, I think it's kind of hard to imagine. But we have a ward of the hospital now that's actually one of our new awards that we are using as a COVID ICU. And it happens to be a really long ward. Everybody's on the ward is in PPE, gowned up, masks on, and doors. All the rooms have been converted into negative pressure. So when you actually walk in the room, all you hear is the hum of a fan. Patients are on high flow oxygen if they're not ventilated, and they look really sick. These are some of the sickest patients that I've taken care of, and some of these patients year and a half ago that we are taking care of with high flow oxygen, I would have intubated and put on a ventilator, but we obviously can't do that. And we learned not to do that, and we've become more comfortable with that. But so when we do intubate patients, it is kind of the last resort. And right now we have about 19 of those. Almost every day at this point, we're having cardiac arrests from patients when their oxygen levels dip too low and we can't supply them with enough oxygen. We've had, there's unfortunately, on the COVID units, we don't allow visitors. It's logistically is almost impossible. We only have family come in at the end of life, and that's a big change for us. Having that family support is, I think, important for patients, but it's also important for our staff, and to be able to communicate with families. We do a lot to do. We have to try to bridge that gap. We have iPads, and we call the patients' families on a regular basis, usually during rounds, and talk to them. We've changed a lot of what we do. Luckily, this time around, we don't have a PPE shortage as of yet. I keep worrying about that. So we're not having to reuse our masks as much, and gowns and things like that. So we're well supplied from that point. But it's much different to see these patients as sick as they are on a daily basis, and they're there for a while. And luckily, many of them get better, but unfortunately, some of them don't.
Okay, our next question is going to come from Nate Hedgie.
Oh, sorry, I didn't realize I had my hand up. I did want to follow up though real quickly on that last point, just about what you're seeing on the ground in North-Idaho, and specifically younger patients. Have you had younger healthy patients or seemingly healthy patients before they get COVID pass away from the disease?
Yeah, we've definitely had several young patients on ventilators. I think we've only had a couple that have passed away. And so it's not many, but those younger patients really do affect the staff quite a bit, and it's very traumatic to see young people that have many years of life left in them pass away. So, but the problem this time around is that it seems to be getting younger, and there is concerns as schools open here that we're going to see even younger patients.
All right, our next question will come from Rebecca Boone.
Hi, Rebecca Boone, Associated Press. Thank you again. I'm wondering, you talked about how masks are really quite effective and how they work. I'm wondering if people who are fully vaccinated and are wearing masks can still feel comfortable mingling with other people in outdoor settings, or should we further restrict behaviors in that way to try to reduce risk?
Right, Dr. Hahn, I'm going to turn that over to you. You can continue on with that theme of questioning.
Yeah, sure, Rebecca. Absolutely. If life were only about, epidemiologists and stopping the outbreak, we would order everybody to freeze in place and not, at least 6 feet away from other people and just stop moving for a couple weeks, and this would be over. we can't do that. So you're right. In a safe, to be absolutely safe. I mean, I know people, I mean, myself included, you know, I'm vaccinated. I wear my mask again when I go to the grocery store or to public places. We wear a mask here in the office when we're not in our own offices. We have returned to wearing masks and to more social distancing. But the individual, some of the other individual behaviors, you know, do you go to a family gathering? Do you go to a larger gathering? Is very hard. Everybody is making their own choices on that. Personally, though, I think whatever you can do, that it is better to be away from other people, even if you're vaccinated and have a mask on. You know, if you had tickets to a concert, if you were going to go to a large gathering, to think about that and to realize that the risk is not zero when you're around other people, even with masking. Although we do think masking is incredibly helpful and beneficial, and you know, I'm comfortable going to most places, going grocery shopping, you know, going places that I need to go. If I have a mask on, I feel very comfortable as a vaccinated person that I can do that. I don't know if Dr. Turner, my state epidemiologist, if she has some other thoughts. We talk about this all the time.
No, thanks, Dr. Hahn. And I would just second everything you just said. I too go grocery shopping with a mask on, even though I'm fully vaccinated. My mask protects you, your mask protects me. So if we were all doing that, we'd all be protected. So.
All right, thank you, Dr. Turner. So I have been given the nod to go ahead and we can take, there are 4 more questions from 4 different reporters in the list here that we'll take, and then we'll end the briefing after that. So next up is Audrey Dutton.
Hi, I think this question is for Director Jeppesen. Have you had any conversations with the governor or Office of Emergency Management or the National Guard about security at hospitals as we hit crisis standards? Patients have already been angry and throwing things and yelling and spitting in faces and things like that. You know, if we're at crisis standards, it's possible that could accelerate it. Are there any conversations about security at hospitals?
Okay, I'll go ahead and take that since I think Audrey was directing that towards me. And so the short answer is yes. I join multiple calls each week with a variety of different hospital leaders across the state. And we have seen an escalation in angry patients or angry family members as well. And so that has escalated the conversation around security at facilities. Fortunately, though, we haven't seen things escalate to the point there would sort of be any kind of drastic reaction or drastic action that needs to be taken place. But it is something that we do keep a pretty close eye on and stay pretty close to the hospitals about what the current situation is and what they're seeing. And these are really emotionally charged issues. You know, you have people in the hospital that are very sick, and family members are concerned about that and are focused on helping them get the care they need, and may have some views on that. And I can understand why that is, but it also is, it definitely is increasing some of the security concerns around the state. Again, I'll just end with that comment, though. We haven't seen that escalate to a point that would require something dramatic or radically unusual. We hope that stays the case as we move forward here. And I don't know if Dr. Scoggin has anything he wants to add to that from what he's seen.
Yeah, I think that, I mean, we obviously, you know, we're always concerned about security in settings where patients are sick and decisions are being made about care, and families are definitely emotionally charged. I think it's just now we have a lot more patients, and we have a lot of people who definitely have strong opinions about things. So, you know, I'd say that our security here has been more vigilant and available, and something we watch all the time and we are concerned with.
Okay, our next question is going to come from Rachel Cohen.
Hi, Rachel Cohen from Boise State Public Radio. I'm not sure who this question is for, but Idaho health systems have said moving to crisis standards is really the last resort and that it was preventable. And last fall, when the state was on the verge of going into crisis standards, Dr. Stephen Emerson of St. Al's said it would be a failure on the part of the community and our leaders if we did have to move to this stage. Do you see it that way too?
Director, do you want to?
Thank you, Rachel. Appreciate the excellent question. I don't think there is anybody on this call. There's not any hospital employee or leader that I've talked to that wants to be at crisis standards of care. It's unfortunate that we've gotten there and despite the valiant and diligent and focused efforts of the Kootenai in particular, but the hospitals up north and around the state. And so, I think there's that kind of black and white distinction of failure or not is difficult. That's a pretty black and white. But I will say that it's not a great place to be. That there are things that we as a community collectively can do to move us out of crisis standards of care. And so that's our request, and we started our comments there, and you've heard it throughout the briefing today, is absolutely the best way, the best method we have to move us away from crisis standards of care in most parts of the state and out of crisis standards of care up north. Is for the public to choose to get vaccinated, to wear a mask, socially distance. If you've been exposed, get tested at the right time to make sure you're not going to affect others. And that is by far and away the very best way we have to avoid crisis standards of care and get out of crisis standards of care.
Okay, our next question is going to come from Melissa Davlin.
Thanks, Nikki. I was wondering, on the hospitalization dashboard, does that include patients who have been transferred out of state to Washington or Utah to other facilities, or is that only hospitalized patients in Idaho? And if it's only Idaho patients, is the state tracking how many patients have been transferred out of state?
Yeah, thank you, Melissa. And Dr. Turner, do you want to address what's on the dashboard?
Yeah, thanks. Melissa, so the data that's on the dashboard are patients in Idaho hospitals. So regardless of where you live, if you're not an Idaho hospital, you're counted in the census for that hospital. That's a little bit different than our case data, which is Idaho cases hospitalized. So if, for instance, an Idaho resident was hospitalized in Spokane, they would be counted as a hospitalized case, but they wouldn't be counted in our hospital census because they're hospitalized outside Idaho. So the data are a little wonky in that sense, but that really is a measure of the burden to Idaho hospitals. It's not looking at outside of Idaho, it's looking at what is the burden of Idaho hospitals in our state. So that's the importance of that metric.
Thank you.
Thank you, Dr. Turner. The data is always trickier than I think it should be. Our last question today is going to come from Kyle Fahnensteel.
Thanks, Nikki, and thanks everyone for your time. We've been hearing reports of long-term care facilities that are overwhelmed with patients. I was curious how many facilities in the state can no longer accept patients, and how does this affect the healthcare system?
Thanks, Kyle. I'm trying to decide who on the call wants to field that question. Director, do you want to do that so you can have the final words also in the press briefing?
Sure. Kyle, thank you for that question. We have had for quite some time a long-term care strike team that's been put together. It's focused on how we help the long-term care facilities navigate this pandemic for many reasons, one of which is not just that they have very vulnerable people there, but also for helping to discharge patients from hospitals. We still do have bed capacity for long-term care facilities across the state, and that's both for SNFs and for skilled nursing facilities and assisted living facilities. However, their biggest challenge is, much like everyone else, is really around staffing. So it's how many staff beds are available. And that has presented some challenges, particularly for discharging patients, particularly COVID positive patients, into those long-term care facilities, mainly because it just requires more staffing and it puts an additional risk at the facility. To address that, we actually, as part of the $10 million that Governor Little approved last week, we actually have a program that essentially will pay extra money to a long-term care facility, and particularly a skilled nursing facility, to take those patients from the hospital and put them into their facility. And the reason for that is to help them offset the cost of staff so they can have adequate staff to do so, and extra costs that they may incur, particularly for COVID positive patients, but for any patient coming out of the hospital. So we've tried to alleviate that barrier with some additional money in the short term to help them with the staffing challenges that they face. But by and large, the long-term care facilities have been fantastic partners through the pandemic, have had one of the most difficult situations to deal with, particularly pre-vaccination, and have really done an excellent job of caring for one of our most vulnerable segments of population in the state, particularly when it comes to COVID. So thanks for the question.
All right, thank you, Director Jepson. With that, we're going to wrap it up for today. We are planning another media briefing at 2:30 p.m. Mountain Time on Tuesday, September 14th. Thank you for joining us today.